to talk about exercise, and we're going to talk about some common myths that probably a lot of us believe in. We might practice them. They cause us to not get very good results when we're trying to be physically fit. I'm going to teach you how to overcome those myths and those challenges with the scientific principles behind exercise. Because the truth of the matter is, if you know the principles behind what works and you know how to apply them, you can get really good results with your exercise in a very short amount of time with a very small amount of effort. Now, you have to work hard for a short amount of time, but in the grand scheme of things, it's not very long. So, what we're talking about tonight is called metabolic conditioning. And when I thought about how I wanted to start this, I thought about saying, I'm going to teach you how to get in the shape of your life in just 12 minutes a day. But then I thought, that sounds like an infomercial, right? Just another one of those infomercial gimmicks that won't work. But I really am going to teach you how to get in the shape of your life 12 minutes a day. And it's not an infomercial, it's following the scientific principles behind exercise. So, let's get going, if my computer works. Take a look at this picture. It's just kind of goofy as we start off. Can anybody see what the ironic thing is with this photo?
They're taking an escalator.
Take an escalator. Wouldn't want to burn too many calories before they got up to the fitness center, right? I just thought that was funny to start off this talk. So, when we start talking about fitness, it's important to understand exactly what fitness is. Because a lot of times we think that the only reason you might work out is if you care about how you look. You know, you want to lose weight, or you want to build muscle, or whatever it is. Or if you're maybe training for an event. You know, a football player has to train because they have to be strong, or a marathon runner has to train so they can do their event. But for the average person, guys, that's not really even what physical fitness is. Yeah, that's part of physical fitness. But true physical fitness, if you look up the definitions, what it means to be physically fit is, can you do the activities that you want to do during a day without exhaustion? Without pain? Can you carry a load of laundry up or down your stairs to the laundry room without being winded? Without having to stop and put the laundry basket down? Or can you go up and down the stairs or get in and out of bed without back pain or knee pain? Right? Can you go outside with your kids and your grandkids and play an hour's worth of tennis where you actually chase the ball where they hit it and hit it back, right? Not just stand there. Or go play an hour's worth of basketball with your kids and your grandkids and your friends. That's physical fitness. Are you able to do those things without exhaustion, without having to take breaks, without having aches and pains? Now, maybe you guys are all here for different reasons, no doubt. We all have our own goals in mind. Maybe you're here to lose weight. Maybe you're here to get stronger. Maybe you really are training for an event. Maybe you just want to be more physically fit. Maybe you just want to be healthy. Hey, you know what? Those are all good reasons to be here. They're all good goals. You're in the right place. You can accomplish any single one of those with the information I'm going to teach you tonight. So, exercise, of all the topics that I talk about, is by far my favorite. And let me tell you why. It's because when you study health and what impacts human health, there is nothing that has more studies supporting it than exercise. There's nothing that's been studied more that has more support than exercise as far as how can it help your body, how can it help your overall health, how can it decrease symptoms that you're having, how can it decrease diseases that you might have, get you off medications you might be on. There's nothing stronger than exercise. And another reason I think it's one of my favorites is that it's one of the most simple things you can do. You just have to do it, right? It takes some effort, but we just have to do it. It's not really complicated. So, as we get going here, take a look. Your fitness level and mortality. In this country, in our current culture, sometimes we get way too caught up on trying to think of what can we do to treat a certain symptom or treat a certain disease, right? I mean, that's what the whole pharmaceutical industry is based off of, giving a pill for a certain disease or symptom. And our culture is really based on that. All these studies that we do, you know, we say, okay, somebody has high blood pressure. What treatment can we do to bring down the high blood pressure? Does a pill work? Let's try these different pills. Does a specific herb or vitamin or a chiropractic adjustment, what's a good treatment for that symptom? And guys, that's really not the right way to go about it. Maybe you can already see the problem with that, but really the better way to go about being healthy is, hey, let's just do the right things that make our body function properly. like follow the 5 essentials that I'm always talking about, eating right, exercising, all those things, doing the things that we know are good for our physiology, and guess what? We won't have the symptoms. We won't have the diseases. We won't have the aches and pains. That's really the way we should be focused on this. We kind of have it backwards, but we do have a lot of studies out that show how exercise does affect specific conditions. So I'm going to share some with you because it leads to the credibility of exercise and maybe helps motivate you into exercising and realizing how it can affect all different aspects of your life. So here's one. Here's a pretty important one. Exercising affects whether or not you're going to die. I can't think of anything more important than that, right? Studies have shown that the more physically fit you are, the less likely you are to die. You're going to live longer if you're more physically fit. And the studies, the interesting part, that probably doesn't surprise anybody, right? Nobody's surprised by that. The interesting thing is, the studies show that that's independent of your body weight. Now you maybe didn't know that. What this is saying is, even if you're overweight, if you're more physically fit, you're less likely to die. You're going to live longer, okay? I don't know if you guys knew this. It's probably going to surprise you though. Harvard Medical Research says that we all have the genetic potential to live 120 healthy years. Most people don't make it that far, right? The average age in this country is about 76 last time I checked. That's how old we are when the average person dies. So, you know, we're a long ways away from where we could be if we were living out our genetic potential. Well, here's a big part of it. The more physically fit you are, the longer you live and the less likely you are to die, regardless of body fat. Now, when I say that, don't misunderstand me, because there are a lot of studies that have shown that excess body fat does cause health problems, right? It is a concern. I mean, if we have excess body fat, we do want to reduce that for multiple reasons. But it is interesting to find out that even if you're overweight and you have excess body fat, if you're more physically fit, you're less likely to die. You're going to live longer just by being physically fit. So maybe you're not a person that learns from just listening. Maybe what I'm saying is going in one ear and out the other. Maybe you're more of a visual learner, right? You have to see it to believe it. You see okay?
Yep.
Okay. Otherwise you can take a chair over there. Good to see you, Jenny. So maybe you're more of a visual learner. So here's a graph for you. So you can see it by looking at it. The blue is people who are unfit. The red is people who are fit. The higher the bar graph goes means the more likely they were to die, be dead, okay? Regardless of what category they were in for body fat, 17%, 17 to 25%, over 25%, all the categories of body fat, look, the people that were unfit in each category were twice as likely to die as the fit individuals. Maybe that helps you see it. Let's talk about another one, exercise and depression. You guys know that 1 out of 10 people in this country are on a prescription medication for either anxiety or depression. It's a lot of people, right? When you look around the room, there's about 10 of us in here. The chances are somebody in here, certainly don't raise your hand, we're not singling you out, but chances are, as you look around, somebody in here is on a medication for anxiety or depression. And I can virtually guarantee you that you all know somebody that's on a medication for anxiety or depression, whether you know it or not, just based on the statistics, okay? So here, look at this. It's been studied that exercising 30 minutes a day is more effective than antidepressant medications at lowering depression and anxiety. Exercise, more effective than antidepressant drugs for lowering depression and anxiety. Okay? You think about the economic impact that can have. How many thousands of people in this country are taking these medications for depression and anxiety, and the cost is coming from somewhere, right? Either they pay for it, or the insurance pays for it, or the state pays for it. Huge economic impact that this has. If we could just start exercising more and get more and more people off of these depression medications, it'd save a lot of money. It's also really good for your health. Now, make sure that you understand that I'm not telling anybody in here to stop taking their antidepressant medications and just go exercise, okay? Any medication that you're on, if you want to get off of that, you need to go talk to your prescribing physician who told you to be on it and tell them you'd like to try to get off it and what your plan is and have them help you do that, okay? Not telling anybody to get themselves off any medications tonight on their own. But we're going to talk about exercise. There you go. If you're feeling blue, exercise can help. So here's probably the most common excuse that I hear from my patients in the office. Guys, we do a program, and we're going to talk about this in a second. I didn't say every patient. Guys, we're going to talk about the program that we do. Some of you are very familiar with it because some of you do it with me. Some of you are going to learn more about it here in a second. But every single patient that I have in this office knows about the program that we do, and 95% of them don't do it. Okay? For different reasons, and hey, that's your own personal decision. But this is one of the most common excuses that I hear from patients is they say, I'm too old to do what you're asking me to do, Dr. Sean, right? Because if there was one thing that I could get my patients to do that would change their health, if there was only one thing, I said, you don't do anything else but just do this one thing for me, it would be to exercise. Because I know that's how profound of an impact it has. I guess if you're a smoker, I'd probably say stop smoking and then it would be exercise. But hopefully you're not smoking anyways. But this is the most common thing that I hear people say, I can't do what you want me to do because I'm too old, right? And there might be different fears or beliefs with this. You might think, you know, I'm scared I'm going to hurt myself. Maybe I'm going to fracture a hip. You know, as ladies age, you start to worry about osteoporosis and hip fractures. Maybe you're afraid you're going to tear a hamstring muscle or something. Or maybe you're afraid you're going to have a heart attack because you're out of shape, right? You stress your heart and it's going to stop on you. But guys, let me tell you that when you exercise and when you do it the right way, it reverses all those things I just talked about, all right? Exercise makes your muscles stronger, so you're less likely to tear a muscle. Exercise makes your bones stronger, so you're less likely to have a hip fracture or have osteoporosis. Exercise makes your heart and lungs and vasculature stronger, okay? So you're less likely to have a heart attack. Now, with that being said, you do have to ease into this stuff. You know, if you're not used to exercising, I certainly don't want you coming in here and working at 100% of your maximum heart rate the first day, right? And I'll probably have to take you to the emergency room. We don't want to do that. So we do have to ease into it. And we're going to talk about that too, how to avoid any injuries or complications. But these are some of the fears that people have. And the truth is that those fears that you have about exercising as you get older and as we age, they're really not true. The fact is exercise reverses all those changes that happen with aging. It reverses them, it keeps us younger, and it keeps us more likely to prevent the injuries and accidents from happening. So the different things we're going to talk about tonight have been studied. Okay? One thing I want to talk about, there was a group that they took of people that were 90 years old and older, lived in nursing homes. They studied this group. They made them go through one of these high-intensity workouts that I'm going to be explaining to you tonight for 8 weeks. Okay? They had no injuries. So these are people 90-plus years old. No injuries. They had a 174% increase in strength. So don't think that just because you're getting older, you can't still gain strength in your muscles. And their walking speed increased 48%. And that might not seem like a big deal to anybody sitting here today. But you guys have all seen the 90-year-olds, how they walk, how they get around.
Just like they drive.
Yeah.
Right? It's about like this, right? For most of them, 48% walking speed increase for those folks is a big deal. Just wait until we're in that situation. So the point is, you can still get great results even as you age. And the particular program we're going to talk about tonight called Max T3, which I keep alluding to, and we'll get to more about what it is. But it's a program that was designed by doctors for patients. When they designed it, they did a test group of 1,000 different patients. These were chiropractic patients, okay? They studied a wide range of athletic abilities, from people that hadn't exercised before to people that were elite athletes, from young kids that were exercising all the way up through elderly. Out of 1,000 people in the test group, they had 0 injuries. 0. Okay? So again, if you're concerned about I'm too old to exercise, I'm afraid I'm going to get hurt, these people, they had 0 exercise out of 1,000 people test group, but what were they doing? They were making sure they had good proper form, right? And they were under chiropractic care, which we'll talk about why that's important for your biomechanics and preventing injuries in a little bit.